I wanted to talk about my baby, my pregnancy.
I have some time. Take a seat.
You know, the most important thing is that Margaret knows her status, so she can take care of herself and make sure she doesn't pass the virus on to the child.
Oh, but the risk is still high.
With preventative measures, there's a 15% chance of you passing on the infection. But that is much better than the 35% chance you have if you didn't know your status and didn't have preventative treatment.
What can we do to reduce the risk?
While Margaret is pregnant, she should take care of herself by eating healthy food, including iron folate, and keeping up with her ARVs.
I'll make sure that she gets all she needs.
And make sure that she's checked in case she contracts any other disease while she's pregnant.
Doctor, when the child is born,
I should have a cesarean, Cindy.
Not necessarily. You know, a normal delivery is perfectly safe with medical supervision, but you may still want to opt for a cesarean if you can afford it, to be absolutely sure of safety. But cesareans take a bit longer to recover from than normal deliveries. So you should think carefully about the choice you make.
After the baby is born, I heard that I should not breastfeed.
No, there is a replacement feeding. That is formula in an open cup and a spoon. But after a lot of research, doctors have discovered that replacement feeding also has its dangers.
Yeah, I did not realize.
Margaret, do you know, women find it very difficult to find clean water to mix with the formula and even enough fuel to heat the water and sterilize the feeding cup.
The method is so complicated, you have to wake up at night to make the solution. If she chooses to breastfeed, then she has 5% chance of infecting the baby. But you must remember that breast milk is very important and nutritious for the baby to fight the infection.
Yeah, though, this is too much.
Margaret, listen, if you decide to breastfeed or give formula, it is up to you. But please, don't mix the both.
Mixing both combines the risk of HIV infection with the risk of the infection from the replacement method.
If you decide to breastfeed, then the baby should have nothing else but breast milk for the first 6 months of his or her life. That means no water, no herbs, and no other foods. Because, you know, actually mixed feeding increases the risk of HIV infection.
Yeah, I did not realize.
When you breastfeed, you should avoid mastitis or cracked nipples. And if you have them, you should seek treatment as quickly as possible.
Otherwise, she should eat well, you know, energy-giving food such as ugali or uji to make sure she and the baby have got all the energy they need.